Thank you, everybody, for inviting me to come and speak today. As Laura said, I'm going to talk to you a little bit about what the National Child Mortality Database is, and then about the work that we've been doing with collaborating with the Shared Health Foundation. But I want to start with this quote. So this is from a bereaved mum. She said, "One of the things you want most when your child dies is learning so that another parent doesn't go through the same devastating experience." And so the first thing I want to do is just acknowledge that every number I'm about to talk to you about is a child that's died. I realise that's quite upsetting. I don't know what the experiences of the people in the room are, so please do feel free to take a moment and leave if it's upsetting. So, the National Child Mortality Database, what do we do? We're a programme of work that collects and analyses data from the statutory child death review process. And the statutory bit is quite important. That process reviews the deaths of all children in England who die of any cause before their 18th birthday. I'm employed by the University of Bristol, and we lead this programme of work, but we're commissioned by the Healthcare Quality Improvement Partnership and funded by NHS England. So what is the child death review process? I've mentioned the fact that it's a statutory process. Importantly, it's a multi-agency process, so it doesn't just gather information from healthcare services, it gathers information from social care, education, law enforcement across the board. And the point of it really is to understand how and why children die and to identify learning to inform policy and practice at all those levels you see there. It did, in fact, as a process, come out of a couple of very high-profile miscarriages of justice back in the early 90s. So people that have been around as long as I have might remember Angela Cannings and Sally Clark were wrongfully convicted of murdering their children. And this process was one of the things that came out of that. So the child death review process itself is conducted by what are called child death overview panels. And as I mentioned, these are multi-agency panels, and they collect a very comprehensive data set when any child dies. We in the National Child Mortality Database collect up all of that information from all of those different organisations and agencies, and we provide national analysis, as Laura alluded to. Very importantly, there's a legal requirement to notify us of these deaths within 48 hours of the death occurring. That's really key because it means we know what's happening quickly, and we can take action to escalate things that we see in the data, or make sure that actions are taken to ensure that children are safe. The other thing I wanted to mention while I'm talking through this slide is just that the process also includes the views and perspectives of families. So when your child dies, you'll be asked to contribute to that review process. That's really important because quite often, as a group of professionals, we might think that we've done everything we can. We might think that we've provided a very good service. And it's not until the family come along and say, well, actually, this didn't work very well and that didn't work very well, that we realise, actually, we haven't perhaps done as good a job as we thought we might. I've mentioned the first type of analysis at the top there, which was our real-time surveillance. So that's that information that comes into us within 48 hours. The second way that we analyse data is for the full child death review data set. Now that takes quite a long time to come into us. It can be up to a year. It can take for a child death review to be conducted. But that very rich and full data set is very comprehensive, and it covers lots and lots of things, one of which is the home environment that the child lived in. I just want to show you this sort of collaboration map before I move on to talk about our work with Shared Health. So you'll see the little orange box move up in a minute when I click, but this shows you sort of where we as a database and a programme fit in amongst all of this. All of these other services and how we kind of fit into what happens. So all those services at the top there providing frontline services for children and families feed into those child death overview panels, as you can see there. And child death review partners, so those are local authorities and integrated care boards. We get involvement, as you can see on the right-hand side there, from bereaved families, from charities, and through our public engagement network. There's a box there at the bottom about data linkage, so we also link our data that we collect with other routinely collected data sets to try and enhance what we've got. And then at the bottom here, this is our policy and influence section. So you can see all these organisations that we work with, that we try to use to influence change and to make sure that we are doing everything we can to prevent children from dying. The first report that NCMD published, which led to Shared Health Foundation getting in touch with us, was this one, the contribution of newborn health to child mortality. And this was published in July of 2022, and you can see there's a few infographics on there, but the important one is this one at the bottom that showed that we had 12 babies that died where poor home environment was felt to be a modifiable factor in relation to that child's death. Now, the term modifiable factor is a term that's used within the child death review process. It's defined as any factor that you've identified which might be amenable to change by a national or local intervention that might reduce the chances of a child dying in the future. So within that group of poor home environment, these were the most common concerns, and this really reflects what Kwejo has just been saying. And I'm sure it won't be a surprise to anybody in this room that these are what we're seeing in terms of the children who are dying that we see case reviews for. So unclean houses, overcrowding, poor repair, damp and mould. So in that report, we made a recommendation to the Department of Health and Social Care, NHS England, and the Maternity Disparities Task Force to make prevention of preterm birth a priority, and that included social initiatives to reduce or mitigate social determinants and reduction of deprivation and housing insecurity. So we made that recommendation a couple of years ago now, and following that report coming out, Shared Health Foundation got in touch with us in August 2022 and asked if we could provide them with data on homeless pregnant women or homeless families with babies, which we were only too happy to do. We did the initial bit of work looking at the finalised child death reviews. So that's that very comprehensive data set that I mentioned. So we looked at just almost 7,000 children that died in England during the period from April 2019 to March 2022. And there were 34 deaths in that time period where homelessness and temporary accommodation were recorded as a factor that might have contributed to the child's vulnerability, ill health, or death. There was then an additional 39 deaths where overcrowding, threats of or enforcement of evictions, extended family accommodation were also recorded as factors that might have contributed to these children's ill health or death. I'm just going to say a word here about that term might, because I know that's probably a difficult thing for some people to hear. It's very difficult in our world in terms of the evidence to say they directly related. Obviously, you can do that in cases like Awab's death. So that's why that language is used in terms of may have contributed to the child's vulnerability, ill health, or death. But what's the scale of the challenge? So although those were the deaths where it was felt that the home environment may have been contributory to that child's death, there were another 200 or so cases where it was recorded that homelessness or living in temporary accommodation was present in that child's life or the mother's life at some stage. So perhaps they weren't homeless at the time when the child died, but they may have been previously. So that included bed and breakfast, hostels, shelters, and other types of temporary accommodation. The threats of eviction or eviction enforcement were present in an additional 14 cases. And then there was a further 114 where overcrowding was recorded within the property. So that first slide that I showed doesn't really express the scale of the challenge, really. And of course, we're talking here about the tip of the iceberg. These are just the children who've died in these environments. There are hundreds of thousands more, as we've heard this morning, where they continue to be living in these conditions. So we did that piece of work for Shared Health Foundation, and that contributed to the APPG publishing this report, which I'm sure we're all aware of. And we were very pleased to be able to provide this evidence to support the work of that group. Following on from that, we had a really helpful discussion about how we might be able to better identify and record deaths where these issues were present. And we didn't have any specific questions in the data set prior to this discussion with Shared Health. So the deaths that we identified previously, we'd just done a sort of free text search and looking for the relevant types of ways in which temporary accommodation was recorded. But we were able to work with Shared Health Foundation to add these questions into the statutory data set. So they're now asked for every single child that dies anywhere in England. So there's a specific question asking if the family were in temporary accommodation at the point where they died. And if you answer yes to that question, it opens your free text box so you can give details of what that is. And we also ask what the housing status was of the child's parents and carers. And you can select from all of those, any of the relevant ones there in that drop-down list. So that means that we're in a position going forward to be able to continue to provide this sort of evidence to Shared Health Foundation and others and government, if necessary, to help to describe the scale of the problem and what we're seeing in terms of children's deaths. The next report we published was this one, looking at sudden unexpected deaths in infancy and childhood. So this looked at all children who died in that period, 2019 to 2021. And then we split them into two groups, so the under ones and the 1 to 17 year age groups. And as Kwejo mentioned in his talk, a lot of these children that are dying in temporary accommodation came into that under 1 year age group. So 10% of the children who we looked at in that report had home conditions reported as a modifiable factor in relation to their death, the same kinds of conditions that I've just mentioned. And the details there I've added a bit of extra detail there in terms of the breakdown for those 34 reviews. So you can see that homelessness and temporary accommodation, threats of eviction, that's 15, overcrowding 13, and poverty and deprivation, there were 6. So that meant that nearly 30% of the infant deaths in that cohort that we looked at were in families experiencing poverty and deprivation, homelessness, or living in temporary accommodation, nearly a third. That report led to a piece of work with another charity that we've worked quite closely with, SUDC UK, and it led to the first ever parliamentary debate on sudden unexplained deaths in childhood. So we were able to provide that body of evidence to show how infants were being affected, including in terms of poor housing. And then that led to this photo exhibition that Shared Health Foundation did in the Houses of Parliament. Was it back at the beginning of this year? March, I think, wasn't it? So in preparation for that, we updated that analysis. And it's a little bit small, I know people can't see, but from 2019 to 2023, so we updated it to include the most recent year. And that was where that figure of 55 that Kwejo mentioned came from. So temporary accommodation was a contributing factor in the deaths of at least 55 children. And 42 of those deaths were babies under 1 year of age. What we saw in that age group was that very often when these families were placed in temporary accommodation, they didn't have enough space for a full-size cot, and that meant they couldn't follow safe sleeping advice. So because they couldn't follow safe sleeping advice, their babies were dying from sudden unexpected death, a sudden unexplained death or sudden infant death syndrome. So that then led to the campaign win that Laura mentioned from the work. So Shared Health took up that evidence and campaigned for the government to update the homelessness code to include cots, which has now been achieved. I mean, I think that's a phenomenal achievement by you guys, and we're really pleased that we could bring that evidence to bear to help you to do that, albeit it's a small part of the problem that we're trying to address here today. My last slide here is just this one. So it's just to show you the other kinds of work that we're doing as a programme in Parliament. So each one of those different colours relates to a strand of work. So the blue one is the work we've been doing with the APPG on temporary accommodation that just sets out those kind of milestones I've mentioned to you earlier. But there's work there that we're doing as well on baby loss, water safety and drowning, and sudden unexplained death in childhood. So I think the thing that I really want to get across is we're here, we're a resource, we've got a population level data that's really detailed and rich, and we're very happy to help in any way we can in terms of providing evidence for these issues that you're all talking about today. Thanks, Laura.